Hello, my name is Skylar Careful, and this is my diagnostic presentation on histrionic personality disorder. I wanted to include a small table of contents so that anybody watching this could view my topics of discussion. And I also wanted to use this slide to talk about why I chose this topic. I chose histrionic personality disorder because I simply find it interesting. I find it interesting that it is basically the female equivalence of narcissistic personality disorder and how those narcissistic tendencies manifest differently in women than men. I was also intrigued by the fact that histrionic personality disorder is not commonly researched and does not have very many studies regarding the disorder. Of course, that made compiling the information for this project a little difficult, but nonetheless, it was interesting to dive a little bit deeper into the information than what we did in class. Let's go into what a professional will see when working with someone that has this personality disorder. Histrionic personality disorder is categorized as a cluster B personality disorder, which is described as the dramatic and erratic cluster. An individual with histrionic personality disorder will display the following behaviors: attention-seeking behavior, even to the point of excess. Most times these individuals are described as the life of the party, and they have a very high need to be the center of attention. If they're not having attention paid to them, they will begin to feel uncomfortable and get upset. These individuals also have a high emotionality, which means that they are quick to anger and frustrate if not receiving the attention or response they want. They have very shallow, rapidly shifting emotions that they weaponize against other people. Next, manipulativeness, whether this is sexually or emotionally, which has to do with the high emotionality I just talked about. But sexually, these individuals are very provocative. They have risky sexual behavior as they have many partners as a way to feel desired and have their need for approval fulfilled. But sexually, these individuals believe that they can have anyone that they want. So they will be very inappropriate sexually to basically anybody. And I will go into later why, as a professional, you have to modify your practice a little bit to try to bar these individuals from being sexually inappropriate with you. Next, I will talk about their concern for external appearance. This concern for external appearance really stems from a need for people's approval and for people to desire them. Much of a person with histrionic personality disorder's life is people pleasing. Next, these individuals will have poor relationships. Whether this is platonic or romantic, they will have a difficulty maintaining almost all relationships, and that's because people with histrionic personality disorder are very surface level. They don't talk about their deep feelings and deep-seated emotions very often. They have displays of emotion, but they cannot talk about their emotions in a healthy, productive way with people that they're in relationships with. Why they also happen to have poor relationships is because they're naive. People with histrionic personality disorder perceive these relationships that they have as much more intimate than they really are. Next, they are very agreeable. Because of their people-pleasing tendencies, they will listen to many things people will say, and they can be quite gullible at times. And lastly, they will have very vague speech. They don't really go in depth with what they talk about. It's very surface level and almost seems uninformed at times. Okay, so how professionals should modify their care when working with people with histrionic personality disorder. For my first one, I have boundaries, boundaries, boundaries. Set strong boundaries as a professional. Patients with this disorder can be very inappropriately sexual towards a therapist. Setting boundaries within professional relationships is always important, but especially so when dealing with those who have histrionic personality disorder. Next, I have role playing. As a professional working with someone that has histrionic personality disorder, it can be very beneficial to implement a role play model where you role play appropriate communication and behavior between a therapist and a patient. Having these guidelines and roles that you stick to during your time together can keep these individuals from crossing boundaries that you have set early on in practice. To move into causal factors of histrionic personality disorder. Histrionic personality disorder is interesting in the way with which there is no certain or concrete cause for histrionic personality disorder, but rather a conglomeration of various possible causes. One of those causes could be past trauma, whether that was neglect by a parental figure or sexual abuse. The sexual abuse may be the cause of the provocativeness and the risky sexual behavior, as they have a diminished self-image and idea of sexuality due to past trauma surrounding sexual abuse. And neglect kind of branches into my second factor, which is attachment style. Most individuals with histrionic personality disorder have an insecure attachment style. When they were children, their parents probably lacked boundaries with them, and they displayed maladaptive behavior. They modeled maladaptive behavior to their children sexually and emotionally, and this can predispose their children to the development of this personality disorder simply just by seeing somebody else model maladaptive behavior. And then lastly, genetic susceptibility. As the case with most personality disorders, if a close relative had a personality disorder, you are more likely to inherit that personality disorder. And it is the same thing with histrionic personality disorder. Symptoms associated with histrionic personality disorder. Individuals with histrionic personality disorder will have behavior problems, whether this is their inappropriate sexual acts or the dramatics that they go to in public, or their narcissistic tendencies of always wanting to be the center of attention. These individuals will also have affective dysregulation. They have rapidly shifting, shallow emotions that are hard for themselves to process. And they're also prone to depressive episodes. Lastly, somatization. These individuals' psychological and emotional problems will manifest into physical symptoms. As a care provider, you have to be very aware of the fact that these physical ailments that they're complaining of may just be a manifestation of their psychological problems. Okay, treatment for HPD. I have 3 main treatment options that I want to go over, and all of them can either be used together or they can be used separately. Most people will try to incorporate a couple of them at the same time. The first is psychodynamic psychotherapy. This is also referred to as insight-oriented therapy, and it can be very beneficial for individuals with histrionic disorder. This approach helps patients to fill in the missing links of their emotional maturation and to help them better understand their behaviors and needs better. They will learn how to communicate in a non-provocative, healthy way and to recognize their maladaptive behavior. Most times for individuals with HPD, their behavior that has now become their personality disorder was modeled to them by role models in their life. And so the goal of this therapy is basically to help them relearn how to behave in a successful and healthy way, how to react in a successful and healthy way. The second I want to talk about is supportive psychotherapy. Supportive psychotherapy is also really beneficial and helps these individuals to improve their self-esteem, reduce emotional distress, and improve their coping skills. Medication can also be given to individuals with histrionic personality disorder, whether antidepressants, mood stabilizers, or antipsychotics, all can be beneficial. Most times, antipsychotics will be used to help improve the affective dysregulation and poor impulse control that you find in those with histrionic disorder. One thing I did want to mention, though, is that a certain type of therapy that you do not want to use with individuals who have histrionic personality disorder is family or group therapy. Individuals with histrionic personality disorder have a high need to be the center of attention, and if you bring a bunch of people into a therapy setting and start allowing them to be the center of attention instead of your patient, they will become uncomfortable and uncooperative. So it is just not a resourceful or good therapy type to use with individuals with HPD. Histrionic disorder is definitely best taken on between the professional and the patient, as the individuals affected by the disorder most often best self-reflect and are more introspective when they're not focused on playing a role or being the center of attention. What role does the brain play? The brain is not affected hormonally or chemically by this disorder, but rather the brain's behavioral and emotional facets are affected. Individuals with HPD learn and become accustomed to their maladaptive behavior as a coping skill for low self-esteem and their insecure attachment style. This is why therapy approaches which utilize cognitive behavioral therapy are successful, because cognitive behavioral therapy helps these individuals understand why they feel and act the way they do, and then teaches them to instead use healthy and flourishing behaviors to cope with life struggles. Obviously, individuals with HPD experience affective dysregulation, which technically is a hormonal imbalance in the brain, but these are learned behaviors that they're displaying. It's not something that they were necessarily born with. And so that's why I say that it's not affected in the typical way that we would correspond with different personality disorders. Where does religion fit in histrionic personality disorder? If one were to consider religion's role in this disorder, you could supplement therapy with religious teachings and belief to provide support for the individual. Religion and faith could be useful in helping those with HPD develop a healthy view of sexuality and their own self-image, as most times these individuals have poor self-esteem and bad sexual practices, very risky sexual behavior. Prevention of HPD. There is no concrete way to prevent the onset of histrionic personality disorder, but being raised in a stable home with adults who model emotional regulation and healthy sexual habits can certainly be helpful. Establishing and teaching your children healthy boundaries can be helpful as well to prevent maladaptive behavior and coping skills which are associated with histrionic personality disorder from developing. As a parent, you just need to provide a stable home. You need to be there for your child when they need you to be there for them, and you have to be able to model emotional regulation and healthy relationships between yourself and your partner. Are men and women affected by histrionic personality disorder? I know that first bullet seems deceiving because I put the answer as no, but what I meant by that is that men and women are not affected at proportional rates. Women account for 65% of cases, whereas men account for the remaining 35%. men are more commonly diagnosed with narcissistic personality disorder than histrionic personality disorder. Approximately 1.2% of the population is affected by this disorder, but some articles state that the percent affected shifts closer to 2 to 3%. Emerging trends, data, and findings on histrionic personality disorder. There is very little research which focuses solely on histrionic personality disorder, but there is some research and data that focuses on Class B disorders in general. According to research cited in a journal from the British Journal of Psychiatry, all classes of personality disorders are more common in high-income countries than the pooled global statistics on personality disorders. High-income countries report 9.6% of their citizens having personality disorders, when the global average is 7.8%. In low to middle income countries, personality disorders only affect 4.3% of the population. This could be due to lower rates of trauma and stress, or simply because money and resources for screening and testing for mental disorders is not a priority in low to middle income countries. Generally, the rates of mental disorders globally have increased by 13% from 2017, and it could be inferred that that rate has also affected HPD positively, although there is no data to back it. And here are my references. Thank you for listening.